Today, I have many announcements and many updates, so this will be a bit longer, but it's all essential information, and I thank you all for tuning in today. And again, big thank you to members of the press who are working overtime to make sure we can keep the people of Rhode Island properly informed. You can see the data on your screen. Unfortunately, our cases continue to rise. I keep waiting for the day when they start to decline. We're not there yet. Today we have another 437 cases. It's our 5th consecutive day of increased cases. And as you can see, we're not where we want to be, but we also aren't flying up the curve the way we were. So we're in a stable situation, and we hope that sometime soon we'll come back down the other side. I would say, as we enter a weekend, and as people are getting more and more bored in their homes, I would just again implore you all to obey the stay-at-home order that is still in effect and will still be in effect until May 8th. It wouldn't be in effect until May 8th if we didn't think it were absolutely necessary. This is a really important moment right now. We're doing great. We haven't seen the surge that we could have seen. We haven't seen the horrible experiences of some other cities and states that have had their healthcare systems completely overrun, and that's because we've been following the rules and doing the hard work of social distancing. So stay-at-home order is in full force and effect until May 8th. That's just around the corner, and I'm asking you all to hang in there. The results that you see show a clear flattening of this curve, and I'm asking you to hang in there for a couple more weeks so we can get back to work as soon thereafter as is safely possible. Okay, on to the important announcements. So when we think about reopening the economy, which is certainly on my mind and everyone's mind, we know that having adequate testing is essential. When we started this crisis, we had one testing center in the state of Rhode Island, which was at the Department of Health's lab. And now we have dozens of testing sites all over the state. We are using multiple commercial labs. We're at a place where we're testing nearly 3,000 people a day. And testing is a key component to allowing us to go back to work and back to school and back to life safely as we deal with the virus until we have a vaccine. You should be pleased to know that this is an area that Rhode Island is doing very well. I just got off of a call with Dr. Birx, and she gave a shout out to Rhode Island in front of all the other governors, saying Rhode Island has tested the most people per capita of any state in the country. And that's a great thing. And on a daily basis, we're testing more people per capita than most countries around the world. So Rhode Island is really at the top in terms of best practices, and that should give you a sense of security and confidence and safety that we are on top of this, and we're going to keep Rhode Islanders safe. At this point, we've tested about 4% of the entire population in Rhode Island. But there's more work to do. So as hard as we've worked, and by the way, so many people on my team are really, this has been a 7-day-a-week effort for 6 or 7, 8 weeks, and I want to say thank you. We still have to do more, particularly in our vulnerable populations. And so I want to take a minute to talk about some of our vulnerable populations. One setting that we are extremely focused on is our nursing homes. We've seen it all over the country. Older populations have the worst outcomes with this disease, and people living in close contact in communal settings, it's just very hard to control the disease. So we are laser focused on nursing homes. Earlier this week, we launched a mobile testing team to support patients and staff at nursing homes, bringing the equipment to the nursing homes. And I've heard from many of you that that's been working. We are now looking at other options to reach vulnerable and homebound individuals. So we're working with EMS, the National Guard, and URI, who is allowing us use of some of their vehicles to provide mobile, on-the-spot testing for those unable to get to a testing site. So next week, I'm going to have more announcements about this mobile testing effort, but I did feel it was important to let you know where we're going. You know, throughout this crisis, I have tried to say to you, here's where we are. It is not perfect. I hear your anxieties that we need to get better. And so here's where we're going. And so what I'm telling you today is, I know we need to do more mobile testing. We need to get more into the community. We need to get to nursing homes, assisted living, other areas of congregate living. And so we're working very hard to find the equipment, the teams, the trucks, the transportation, the reagents, coordinate all that logistics. It started, it's working, and we're going to really start to push it out more next week. We're also increasing testing access for the hardest hit neighborhoods, some of the poorest neighborhoods, neighborhoods where folks are very densely, in dense living situations, and where frankly not a lot of people have cars. So we've announced walk-up testing sites in Pawtucket and in Providence. I've already heard these testing sites are making a big difference in these communities. They're each testing more than 100 people a day. That is a great thing to know, that people in those communities who don't have cars can just walk over to the parking lot and get tested if you have an appointment. And I want you to know we're going to do more of that. It's been successful. We have a lot more to do. So in the next couple of weeks, we're planning to add walk-up sites and other testing facilities in communities where we know there's a greater need. Communities in Cranston, more in Olneyville. We need to get to Woonsocket, in the East Bay, Central Falls. These are all on our list. We hear you. We are on it. We're working as fast as we can to bring the testing to you in walk-up settings, because we are fully aware that not everybody has a car. I'll say this. I am highly focused on vulnerable populations. We're not where we are, but we're getting there. We're getting there faster than almost any other state in America, and we are going to stick with it until we have the kind of widely accessible testing everywhere. If you look at the experience of other countries, for example, Singapore. Singapore at one point, a month ago, it seemed like they had this under control. Except now they're on complete economic lockdown again, because they had a community of migrant workers living in a communal situation, and they took their eye off the ball on that vulnerable population. And so we don't want to do that. We do not want to. We want to learn from that experience, and so that's why you're going to hear me talking a lot about testing and quarantining and support for vulnerable populations, because we can't let anybody be behind. By increasing our testing capacity, it's more than just the diagnostic tests and then putting folks into isolation and quarantine. It's also understanding more about the overall prevalence of the disease in our community and in our state. And many of you have been asking me about the antibody test. Members of the press have been asking me. So I'd like to take a minute to share with you our view and our plans. So earlier this week, we received a shipment of 20,000 antibody tests. These are finger prick tests. They're blood tests for antibodies in a person's system. Now that we have the tests in our possession, the first step is to validate those tests. And that's a process which we will do here in our state. We're working with experts in our hospitals and at Brown University, and we're going to validate the test, and then we're going to test a sample of randomly chosen people across the state of Rhode Island to try to get information about the prevalence of the virus in our state. We know, obviously, that a lot more people have been infected than we've been able to test. I mean, that's a fact. We don't know exactly how many. And so the whole point of these serology tests, the antibody tests, is to give us a better sense of what's going on broadly in the state, what % of our population has had the virus, what %'s been exposed to the virus, and therefore their bodies are developing antibodies. Now, I want to be clear about a couple of things. These kinds of tests do not replace the diagnostic test. The purpose of these blood tests is to give us a picture of what's going on in the state, how prevalent is it, where are the hot spots. They are not intended as a way to tell you whether you have the virus and you are positive. That's why we still need to go what they call the PCR test, the test with the big machines, which is based on your saliva or other, they use the nasal swabs, and that's at CVS or in other places. I also want to be clear, this isn't a quick process. So conducting the random sample with the serology test and analyzing the results for prevalency takes time. It takes more time than it does for the current nasal swabs that we are using. And it requires expertise and science to get it right. And my whole name of the game from day one is to be focused on facts and science and be highly professional and expert in everything that we've been doing. So to that point, today I'm announcing that we are assembling a testing and validation task force with experts from around the state to help analyze and draw conclusions from the data that we find with these serology tests. And I want to announce that we have two fantastic co-chairs of this task force, both from Brown University and Lifespan, Dr. Angie Caliendo and Dr. Jonathan Curtis. They will be our co-chairs of the task force, and they will work with Dr. Nicole and her team to do what's required to validate the test, set up the study, and then evaluate the outcomes. I want to tell you it's going to be weeks, not days, before we have results to share. I'm sure one of the first questions will be, Governor, when are we going to do this random sample? How many people are we going to sample, and when are we going to have the results? The answers are, let's let the task force and the experts do their work, and I don't know. But I do know it's going to be weeks, not days, because we want to get it right. In the meantime, if you have symptoms, if your doctor tells you you need to get tested, go do that at one of our testing centers. We're still going to continue to test 3,000 plus people a day. I'm happy to answer any questions about that. Okay, moving on to some more of the economic factors related to the crisis. So throughout this crisis, I've been telling folks to stay home if you can. If you can work from home, you have to work from home. Having said that, some of us have to go to work. That's just a fact. There are many of us who have had to go to work every day. And if you're one of those people, I want to thank you. I want to thank you for your courage and your stamina and for everything that you've been doing to keep the people of Rhode Island safe. I've said it so many times, I'll say it again. You really are heroes. Every single person who goes to work every day feels a little nervous, myself included, all of us. And if you go to work in a nursing home or communal setting or assisted living or a group home, that's triply true, or hospital. So I want to again thank you and let you know you are top of mind for me. You inspire me, and we want to do everything we can to support you. It's been a tough time. It has been such a tough time, especially for those providing care on the front lines in communal healthcare settings, nursing homes, group homes, assisted living, and the like. These operations are 24/7. You interface with patients, and this is where we've seen the outbreaks of the virus. Added on to that, many of these employees who are caring for our loved ones in these communal settings are low-wage workers. These are folks who go to work every day making $12, $13, $15 an hour under very trying conditions and making it so that our loved ones can be cared for. Not surprisingly, we are hearing of staff shortages. We're hearing, particularly from nursing homes, group homes, serious staff shortages. That is a reality. I had been hoping that by now the federal government, Congress, would have done something to provide a wage subsidy to help us stabilize that workforce. And I still hope that that will happen. And by the way, I want everyone to know that our federal delegation, our congressmen and senators, favor that, and they're working hard for it. In the absence of that, I've decided to take action, because these folks, we have to help them, and we have to send them some relief. Frankly, we have to give them a raise for doing the job that they're doing, and also help to make sure that these staff shortages don't continue, because we need to fill these shifts. So I'm very pleased to announce right now a congregate care workforce stabilization fund for private providers in Rhode Island. The fund will provide temporary pay increases for the next month to low-wage frontline workers at eligible Medicaid-funded residential facilities. So again, residential communal, nursing homes, group homes, homes for the developmentally disabled. These raises, these wage subsidies are targeted at people, available for people that make $20 an hour or less. So again, these are really the people doing the hardest work under the toughest conditions at the lowest wages. Starting next week, employers can apply to the Office of Health and Human Services. This isn't forever. We cannot afford to do this forever, and I am optimistic that Congress will do something. It's temporary, but it's now. I want you to start receiving a raise in your paycheck as soon as possible. So starting Monday, we're open for business. I'd encourage the providers to apply, and we want to see this in the paychecks of folks starting that first week of May. We also know that these congregate or communal care settings need additional supports. I hear it every day, all kinds of additional supports. More testing, more PPE, more information. So I hear you, and to that end, starting this weekend, starting tomorrow, I've directed the Rhode Island National Guard to provide additional support in these communal care settings. So the Guard is assembling teams of professionals to provide additional support to nursing homes, group homes, and the like. They're going to help with infection control. They're going to help with PPE guidance. They're going to help with testing questions. They're going to help you. Help is on the way. That is my message. If you're in a nursing home, if you're in a congregate care setting, help is on the way. These are experts. They know what they're doing. They've been dealing with this, and they're going to come to you and provide you with on-site help. So again, it's not enough. I know it's not enough, but it's a lot. It's more than we've had, and I hope it responds to some of the anxieties, justified anxieties that many of you have and you've been dealing with. And thank you. Thank you for working through it and sticking with it. Okay, more news on the economics of this. So I say every day, and I read the emails and get correspondence every day from Rhode Islanders who are struggling beyond belief. It's really tragic, the economic devastation that's happening. And sadly, the crisis is hitting those who can least afford it the hardest. You know, as I said, if before COVID-19 you were struggling, you were in a low-wage job, you could barely make the rent, you are really struggling now. And I just want everybody to remember that, especially those of us who are lucky to not be in that position. I want you to know a lot of Rhode Islanders are really, really hurting right now. And they don't know how they're going to pay their rent. They don't know how they're going to pay their bills. They don't know how they're going to continue to go on like this, which is why every day I begin my day by saying, how can we provide you more support to get through it until we can get you back to work? So I have a little bit of relief and some good news for folks who are worried about paying your bills and, frankly, affording a place to live, because I don't want you to worry about that right now. You have enough to worry about. I'm proud to announce now that more than 20 financial institutions in Rhode Island have pledged to step up and help our community in this time of need. They've pledged the following relief to residential borrowers. First, a 90-day grace period for all residential mortgage payments for individuals impacted by COVID-19 with the opportunity to ask for additional relief. Second, an agreement to not report late payments to credit reporting agencies for residential borrowers who take advantage of the relief. So it's a 90-day grace period for your mortgage payment, and they won't report it to a credit rating agency, so it won't affect your long-term credit. A 60-day moratorium on initiating residential foreclosures and evictions. And finally, an agreement to waive mortgage-related late fees. The last thing you should have to deal with right now is a late fee. Thank you. This is a very big deal. The list of the participating financial institutions will be made available today on the DBR website, dbr.ri.gov. It includes credit unions, small banks, community banks, and some of the biggest banks that operate in Rhode Island. You're doing the right thing. You are doing the right thing, and as your governor, I am so proud of you. Actually, I want every Rhode Islander to take a minute and go on the DBR website and look at the list of those 20 financial institutions who are doing the right thing for the right reasons to support our community. And if you're hearing me and struggling to pay your mortgage and worrying about late fees, I really want you to go to that website and see if your banker is there, because there's some good relief on the way. That initiative, which is collaborative, that's not due to my regulation or executive order. That's us reaching out to the community and them stepping up to do the right thing. It would not have happened without the leadership of Commerce Secretary Stephen Pryor and the president of the Commerce Corporation, Jesse Saglio. Huge amount of shoe leather and work and effort went into that. Hats off to both of you and your teams. And I hope it provides everybody out there with a little breathing room, because I know times are really tough right now. I do want to remind everybody that courts are closed for non-essential business through May 17th. So again, breathe a sigh of relief. You cannot be evicted. You can't be evicted between now and May 17th because the courts are closed. I also want to announce that starting next Thursday, we'll be making available $1.5 million in rental assistance for the lowest income Rhode Islanders across the state. I need more time to finalize the details of that, so next week I'll let you know precisely who's eligible and how we plan to administer it. But it's Friday, people are anxious, so if you're a low-income person and you're stressed about paying your rent, I just want you to know help is on the way. I just need a little more time to figure out the details, but we're gonna do our best to help you out. A couple more things. Hang in there with me. We've been busy. Earlier today, the President signed the Paycheck Protection Program extension. I'd like to thank him for that, and again, thank our federal delegation. I can't emphasize how hard this past few weeks have been for the small businesses of Rhode Island. All of you are being so brave and so creative and so resilient. It's unbelievable to me. But I know you're hurting. I used to run a business. I know what that's like. You have employees, you have bills, you have debt, you have creditors, you have customers, and it's a very anxious time. So I want to give you a little bit of good news. Congress has replenished the Payroll Protection Program. If you recall, it came out before and ran out of money very quickly. I also know many of you struggled to figure out how to access it. So this is a message for you. There's more money now available in the Payroll Protection Program. You can apply for this funding through your financial institution, your bank. Call your bank. Call your bank right now if you need a loan and you haven't gotten it yet. I don't know when the applications will be processed, but every business that needs help should be talking to your banker. In fact, if I were you, I'd stop listening to this press conference and go call my banker. Don't delay, do it now. The quickest way to get information, including what kinds of documents that you'll need when you're calling your banker, is to go to the Commerce RI website. I've heard from so many of you that it's confusing, the paperwork is confusing, you can't figure out how to do it. And I know the federal government was moving fast to get this out the door, so that's sometimes what happens. So if you're not sure, go to commerceri.com, and we've done our best to simplify it for you. Now, this is another important announcement. If you're a small business and you don't have an existing relationship with a banker, you say to me, Governor, we don't have a banker. We don't have an existing line of credit. We're too small for that. Then I want you to write this down. I want you to email ppp@commerceri.com. Shoot us an email at ppp@commerceri.com. And we're going to get you matched up with an available financial institution and make sure we do everything we possibly can to get you the money that you need through the PPP program. This is a big deal, because I know some of you said you just can't call your banker. We've been working very hard, and we have some good options available for smaller businesses or any businesses that are unbanked. But move on this quickly, because we know there's going to be huge demand. ppp@commerceri.com, and we'll help you out. We'll get you hooked up with the bank, and we'll do our best to get you the funds. Commerce hosted a Facebook Live event earlier today. They tried to answer frequently asked questions about the program, and the event is saved and can be replayed on the Commerce Facebook page. So I'm happy to answer any questions about this. I know that's a lot of information, but it's good. That's good news, and I hope it helps you. Okay, a couple of more things I have to get through, and I appreciate your patience. So for weeks now, we've been working around the clock to prepare our hospital system for a surge. And again, I cannot thank enough Care New England and Lifespan, the National Guard, EMA, the building trades unions, all the men and women that worked overtime to make it so that we have our field hospitals available. While we've been doing that, we have asked our hospitals, and our hospitals have on their own, curtailed non-critical surgeries. And that was the right thing to do. It happened all over the country. It was necessary. We now need to get back into the business of allowing hospitals to do some of these non-critical surgeries. If you're a patient who's been inconvenienced, I'm sorry that you've had to wait. If you've been waiting to have your surgery and you've been told it had to be rescheduled, that's at best inconvenient, at worst, causes health issues. So I am in a rush to help you get rescheduled safely. If you're a hospital, this is a key source of revenue. Throughout this, we have to make sure that our hospital system is secure and financially stable. They did the right thing by shutting down these non-critical surgeries and focus on the surge. But now we need to do the right thing and work as hard as we can to help them begin again some of these non-critical procedures. It isn't just surgeries, it's procedures that they're in the business of doing, so they can take care of Rhode Islanders, and so their bottom line starts to get a bit healthier. So with the Department of Health, we have directed every hospital to provide to us by Monday their plans for how they can safely begin again these non-critical procedures. And it's going to be different. They have to account for infection control, different workflow, isolation of patients, make sure they have enough PPE available, make sure they have the staffing. It's a long list. I don't want anyone to think we're just reopening without a great deal of thought and care and the appropriate equipment. But it's time. It's time that we start to do this. It is a big step forward, and I look forward to collaborating with our hospitals to make this happen. I will say, as I've said before, when we get to the business of reopening our economy, it will happen in stages. And this is a great example of it. This is a beginning stage. Hospitals are very well positioned to be able to enable this safely, and it's necessary for them and for the people of Rhode Island. So thank you to the hospital administrators for working with us, and we look forward to working with you on your plans. After we see the plans, evaluate the plans, work collaboratively with the hospitals, I'll be able to come back and say, give you a date by which some of these hospitals will be incrementally bringing back some of these procedures. Finally, I want to take a minute to talk about something that is difficult to talk about, which is the increase in violence, domestic violence, in our community that we have seen since this pandemic began. And I've talked about this before, and a few of you have said, why are you talking about that from a press conference? Because it matters, and it's important, and it might make you uncomfortable, but we have to keep everybody safe, and that means keeping everybody safe in their home. So the sad reality is that while we've all been cooped up in our houses and struggling financially, our kids are learning from home, everybody's anxiety is higher, we've seen a big increase in 911 calls on account of abuse happening in the home. And that's not okay. So we have to come together as a community to do everything we can to reduce that and alleviate that. The fact of the matter is, not everybody is safe at home. And unfortunately, that seems to be doubly true now. So if you're hearing me say this and you feel unsafe, I want you to reach out for help. If you're hearing me say this and you are safe, I still want you to pay attention, because maybe somebody in your neighborhood or at your place of work isn't. And I want you to be extra aware of that and know yourself how you can reach out for help on their behalf. I directed my team several weeks ago to put together a plan, a comprehensive plan to deal with this, because we've started to see the increase in 911 calls for several weeks now. So the team worked with advocates, and they put together a comprehensive resource document that's now available on the Department of Health's website in English and in Spanish. The document is meant to be a resource for everybody. I also want to remind everyone that hotlines are still available, shelters are still available, all of the supports that have been available in the past are still available now and have capacity to take care of you. We've checked in, and the system has capacity to take care of you and keep you safe. I also want to let you know that next Thursday at 11 a.m., I'll be joined by our federal delegation, Senators Reid and Whitehouse, Congressman Langevin and Cicilline, and Attorney General Noronha, and advocates from the community and members of my cabinet to do a violence prevention Facebook town hall. We'll be advertising for that, but I would encourage all of you to try to tune into that. As I said before, it's just an opportunity for us to become informed. So if you are lucky enough to be in a safe, secure home surrounded by loving friends and family, then that's great, and I'm happy about that. But I still want you to get informed, and I still want you to try to participate in that 11 a.m. Facebook town hall, because I guarantee you, I promise you, there's somebody in your life who isn't. And it's your job to get smart and reach out to help them to get safe. So last thing. If you want to send me an anonymous email so that I answer questions at that Facebook town hall, please send email to communications@governor.ri.gov. Don't have to identify who you are. Just send the email. It's secure, and I'll do my best to provide an answer. And if you want to identify yourself, that's great, and we'll reach out to you.